Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the normal and abnormal curvatures of the vertebral column. There are four curvatures of the adult vertebral column in a normal person. These are the primary curvature that are developed during fetal life. They are the thoracic curvature. This is the thoracic curvature here. And we have the pelvic curvature, also called sacral curvature. These two are primary curvature. They have convexity backward, concavity forward, and that is in concert with the fetal position because fetus is in the mother's uterus in flexed condition, and in that condition we'll get this type of curvature of the fetal vertebra. Then we'll get the secondary curvature that develops during infancy and childhood. Exactly, it begins to develop during the late embryonic period, but it is established, it is more developed during infancy and childhood. They are the cervical curvature. This is cervical curvature. Idea is that when the newborn baby is born, then after a few months later, the baby is crawling and like to raise the head, and the cervical curvature is well developed after 3 to 4 months. That is the cervical curvature or cervical lordosis. Lumbar curvature, lumbar lordosis, when the toddler start walk around 1 year, then the lumbar region has a curvature well developed here. After walking is established, that is the lumbar curvature. So this happen around 3 to 4 months after birth, and this happen around 1 year, but they begin to develop during the late embryonic period. Normal curvature has a lot of function. The most important is that they provide additional flexibility for shock absorbing resilience along with the intervertebral disc. Increased load borne by the vertebral column, both the intervertebral disc and the flexible curvature are compressed, and the curvature of the vertebral column increases. Normal curvature provided by the vertebral column is dynamic process. Long extensor resists excessive thoracic kyphosis. Long extensor, as for example the erector spinae muscle, it prevents excessive forward bending. Abdominal flexor, especially the oblique muscle, the external oblique, internal oblique muscle, they resist excessive lumbar lordosis or backward bending of the vertebral column. Flexibility role of the intervertebral disc are passive, provided by the zygapophyseal joint between the facets of the vertebra and the longitudinal ligament. We have anterior longitudinal ligament, posterior longitudinal ligament. They contribute in the flexibility of the intervertebral disc. Now we'll go to the very common condition, that is scoliosis or crooked or curved back like this. This may happen. Lateral bending of the vertebral column. The structural scoliosis, the lateral bending is associated with vertebral column rotation. Scoliosis is common in adolescent girl and it is idiopathic. We don't know the exact cause. It may also be present on rare occasion in the adolescent boys too, usually at the age of 16 or 17. But in the adolescent age around 12 to 13, a lot of girls may have this problem like scoliosis, a significant number of girls. But it may be present in the boys also. Scoliosis may be secondary to an underlying disorder, that is muscular dystrophy, spinal muscular atrophy, or spina bifida, and hemivertebra, one side of the vertebra may not develop, so the vertebral body look like a wedge, so there will be scoliosis. Temporary scoliosis is possible due to protective action of the muscle in painful spine, or compensatory scoliosis occur when the pelvis is tilted laterally due to unequal leg length, and also in case of hip joint deformity. Unequal leg length is possible in case of poliomyelitis. One leg may be small, another leg may be normal. So one is shorter, another is longer. So the prosthesis may not work. Also, in a person with artificial limb, if the prosthesis is not perfect, then there may be compensatory scoliosis. Okay, so in scoliosis, we do the physical examination, we look at the back from the side and back, and we look for the Cobb angle. Cobb angle is assessed to understand the degree of scoliosis. Okay, here forward bending on the vertebral column, thoracic segment of the spinal cord is affected with Duagar's hump. Here is Duagar's hump. Osteoporosis in the elderly is the most common cause. Other causes are tuberculosis, metastatic tumor, fracture of the vertebral body, osteochondritis, ankylosing spondylitis. I have taken this image from the Microsoft PowerPoint from the Creative Commons, like the previous one that is also taken from the Microsoft PowerPoint Creative Commons. Okay, this is also another good image from Microsoft PowerPoint Creative Commons. This is axis lordosis here. What is that? Backward bending of the vertebral column. This happens in the lumbar region here mostly. So scoliosis mostly affect the thoracic region. Lumbar region is affected by lordosis. Normal lordosis is present in cervical region and lumbar region of the vertebra. As we discussed, when the baby like to raise the head, or when the baby start walking or standing. Lordosis is seen in obesity and also in pregnancy because line of gravity changes. Lordosis may be associated with strong extensor muscles of the back and tight hamstring like that of the semimembranosus, semitendinosus, and the biceps brachii muscle. On one side, on the other side, counterparts, the abdominal muscles are weak. So strong extensor muscle like erectospinae and weak abdominal muscle like external oblique, internal oblique. So then there may be a chance of lordosis because of overactivity or overaction of the extensor muscle. Abnormal vertebral curvature may cause back pain and pulmonary insufficiency, and it decreases the height of the person, especially in case of kyphosis. There is bony degeneration, atrophy of the bone, vertebra, and also curvature that decreases a person's height, and changes in the line of gravity make the individual prone to fall. So this elderly person may fall because line of gravity has been changed. Diagnosis by physical examination and X-ray. Treatment. In case of pregnancy, we wait for the delivery of the baby, so no treatment is required. In case of obesity, we may decrease the body weight. This is the way of management. And also in case of muscular weakness, we can give some physical therapy so muscle strength may be regained. Good posture is very important. Sitting posture or lifting some heavy object, we need good health education and ergonomic. Brace may be helpful initially surgery may be required in the last days. And that's all about the normal and abnormal curvature of the vertebral column. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. And have a nice day. Bye now.